Every single minute, someone over the age of 50 experiences a stroke warning sign and completely ignores it. I'm Dr. Valerie Stone, and in my 20 years as a practicing physician, I've watched 87% of stroke patients arrive at the emergency room saying the exact same words, "I thought it was nothing." The 5 warning signs I'm about to share with you today are so subtle, so easy to dismiss, that most people experiencing them right now will do absolutely nothing until it's catastrophically too late. Before we dive deep, I need to hear from you. Write in the comments what scares you most about stroke and tell me what city you're watching from. This helps me create content that truly serves our thinking community of people over 50. Let me tell you about Margaret. Margaret was 58, a retired school teacher from Portland. 3 months before I met her in the hospital, something strange started happening. Every few days, she'd feel a weird tingling in her left hand. It would last maybe 20 seconds, then disappear completely. Margaret thought it was carpal tunnel. She mentioned it to nobody. Then one Tuesday morning, Margaret's left side went completely numb. She collapsed face first into her garden. Her husband found her 40 minutes later. During those 40 minutes, a massive stroke destroyed a third of her brain's motor cortex. Margaret survived, but she never walked independently again. Those tingling episodes she ignored, they were mini strokes. Her brain was screaming at her for 3 solid months. Your blood vessels don't suddenly fail. They give warnings, loud warnings. But these warnings are disguised as minor annoyances we brush off because we're busy, because we don't want to bother anyone. Today, we're going to decode all 5 of them together. Warning sign number 1, sudden episodes of confusion or difficulty finding simple words. We joke about it. We call it a senior moment. But when blood flow to your brain's language centers gets restricted, even for 30 seconds, you experience something called transient aphasia. You know exactly what you want to say, but the word just vanishes. Think of your brain like a vast city with millions of streets. When a street gets blocked, even temporarily, that entire neighborhood goes dark. That's exactly what happens in your brain when a blood clot temporarily blocks a vessel. A study in the Journal of Neurology followed over 12,000 people who experienced these brief language difficulties. Within 1 year, 33% of them had a major stroke. 1 in 3 people who ignored the warning. Robert was 62, an accountant from Chicago, sharp as a tack with numbers his entire life. About 6 months ago, he started having odd moments during conversations. He'd be explaining something and suddenly couldn't remember a simple word. He'd pause, feel embarrassed, then the word would pop back 10 seconds later. Robert figured he was just tired. These episodes became daily. Robert's wife noticed he was calling their grandchildren by the wrong names. She urged him to see a doctor. Robert said he'd make an appointment after tax season. He was too busy. 3 weeks later, during a client meeting, Robert collapsed. Massive stroke. The CT scan showed dozens of microstrokes over 6 months. His brain looked like Swiss cheese. Each time he forgot a word, a small piece of his brain was dying. So what should you do? If you experience sudden word-finding difficulty more than twice in 1 month, see a doctor within 72 hours. Ask for a carotid ultrasound and an MRI. Write down every episode. What time? What word? How long? Your doctor needs this pattern. Your brain is speaking to you. Write down what it's saying. If Robert's story made you think about your own health, please support this video with a like and subscribe to the channel. It helps more people over 50 discover these conversations. Now let's continue. Warning sign number 2. Brief episodes of vision loss or seeing strange shadows in one eye. People think they need new glasses, or their eyes are just getting older. Let me tell you what's really happening. When a blood clot travels up through your carotid artery toward your brain, it sometimes gets temporarily stuck in the artery feeding your retina. Your vision in one eye goes partially or completely dark for 5 seconds to 5 minutes. Doctors call this amaurosis fugax. I call it a flashing red emergency signal. Your eye is an extension of your brain. If a clot can temporarily block your eye, it can permanently block your brain. The American Stroke Association tracked 9,800 people who experienced temporary vision loss in one eye. Within 90 days, 27% had a major stroke. Within 1 year, 41%, almost half. Patricia was 55, a librarian from Boston. She was shelving books when suddenly her right eye went completely black, like someone had pulled a shade down. She grabbed the shelf, terrified. After 40 seconds, her vision came rushing back. Patricia decided it must have been low blood sugar. She'd skipped lunch. Over 2 months, this happened 3 more times. Patricia finally mentioned it to her sister, who drove her to the emergency room. The carotid ultrasound made everyone go silent. Patricia's right carotid artery was 92% blocked, just a thin thread of blood getting through to her brain. The surgeon told her she was walking around with a loaded gun pointed at her brain. Patricia had emergency surgery the next morning. They removed a chunk of calcified plaque the size of a grape. That's what had been breaking off and floating up into her eye. Patricia is fine today, but if she had waited 1 more week, she would have had a massive stroke. Your action step? If you experience vision loss in one eye, even for seconds, get to an emergency room immediately. That same day. Tell them you're experiencing amaurosis fugax and you're concerned about stroke. They will run the tests that might save your life. Warning sign number 3. Sudden, unexplained dizziness or loss of balance that comes and goes. You stand up and the room spins. You're walking and suddenly feel like you're on a boat. You reach for a wall, then everything is fine. You think it's vertigo, an inner ear problem. You're wrong. Your cerebellum, the part controlling balance, is incredibly sensitive to blood flow changes. When blood flow drops even slightly, your cerebellum stops working properly. You feel dizzy, lose balance, feel nauseous. The Journal of Emergency Medicine followed 14,000 patients who came to the ER with dizziness. Most were sent home with a diagnosis of benign vertigo. Within 30 days, 9% returned with a major stroke. James was 67, a retired firefighter from Seattle. 4 months ago, James started feeling dizzy when he bent down to tie his shoes. He'd crouch down, stand up, and the room would tilt. James figured it was old age. The dizziness got worse. Started happening when he turned his head quickly, got out of bed, reached up high. James kept postponing the doctor appointment. Then one Saturday, James bent down in his garage, and when he stood up, the dizziness was so severe he fell backward. His wife found him unable to stand, words slurred, face drooping. The CT scan showed a stroke in his vertebrobasilar system. The neurologist explained James had probably been having mini strokes for months. Every dizzy spell was a small clot temporarily blocking blood flow. James spent 3 weeks in the hospital and 2 months in rehabilitation. He walks with a cane now and has permanent balance problems. He tells everyone, "I ignored the warnings for 4 months. I was an idiot." What should you do? Pay attention to the pattern. When is the dizziness worse? Write it down. Do this simple test. Stand with feet together, arms at sides, close your eyes. Can you maintain balance for 30 seconds without swaying? If not, your cerebellum isn't working properly. Get it checked immediately. Warning sign number 4. Sudden weakness or numbness in an arm or leg that resolves quickly. You're sitting and suddenly your hand feels weak. You can't grip the remote. Or your leg goes numb while walking. Then 2 minutes later, everything is normal. You think that was weird and move on. What you experienced was a transient ischemic attack, a TIA, a mini stroke. A blood clot temporarily blocked blood flow to your motor cortex. Your brain lost oxygen briefly. A TIA is a final warning. Next time, the weakness won't go away. Research in The Lancet followed over 26,000 TIA patients. 18% had a major stroke within 90 days. But half of those strokes happened within the first 48 hours. If you have temporary weakness today and do nothing, you might have a massive stroke by Tuesday. Dorothy was 61, a nurse from Denver. At work, updating a chart, her right hand suddenly went weak. The pen fell. Her hand felt like concrete. She shook it, and within 90 seconds, strength returned. Dorothy knew exactly what that was. She's a nurse. But her shift wasn't over. They were short-staffed. She didn't want to cause a scene. So she finished her shift, drove home, made dinner, went to bed. She planned to call her doctor in the morning. Dorothy never made it to morning. At 3 a.m., her husband woke to strange sounds. Dorothy's entire right side was paralyzed, face twisted, couldn't speak. By the time they reached the hospital, the damage was done. A major stroke destroyed a large section of her motor cortex. Dorothy spent 6 months relearning to walk, use her hand, speak clearly. She never worked as a nurse again. If you experience sudden weakness or numbness, even if it goes away, call 911 immediately. Tell them you think you had a TIA. You don't have time to wait. Compare emergency tests to spending the rest of your life unable to walk or speak. Here's a self-assessment. Raise both arms straight out, palms up. Close your eyes, hold 10 seconds. When you open them, are both arms at the same height? If one drifted down, that's weakness. Also, lift one leg at a time off the ground. Hold 5 seconds. Does one leg feel heavier, weaker? These tests reveal subtle weakness you might miss. Warning sign number 5. Sudden severe headache unlike any headache you've experienced before. We think headaches are just headaches, tension, stress, caffeine withdrawal, but certain headaches are vascular emergencies. When a blood vessel in your brain starts to weaken or leak, it causes what doctors call a sentinel headache, your brain's alarm system. These headaches come on suddenly within seconds. They're severe, often the worst headache of your life, focused on one side or behind one eye, often with neck stiffness, light sensitivity, or nausea. This isn't gradual tension. This is a thunderclap, an explosion. About 15% of hemorrhagic strokes announce themselves with a warning headache days or weeks before the major bleed. Your blood vessel develops a weak spot, an aneurysm. It stretches and leaks a tiny bit of blood. You feel severe headache. Then the leak stops, headache improves, you think it was a migraine. But that aneurysm is still there, still weak, still growing. When it ruptures, blood floods your brain. Hemorrhagic strokes have a 40% mortality rate. The New England Journal of Medicine studied patients with sudden severe headaches, sent home with migraine diagnosis. 12% came back within 2 weeks with major stroke or ruptured aneurysm. Stephen was 54, a high school teacher from Atlanta. One evening, grading papers, Stephen felt sudden sharp pain behind his left eye. So intense he cried out. His wife ran in. The pain lasted 10 minutes, then faded to a dull ache. Stephen took ibuprofen and went to bed. Next morning, he felt fine, figured it was stress. 3 days later, teaching a class, the headache came back 100 times worse, like a bomb detonated in his skull. Stephen collapsed. Students screamed. The CT scan showed massive subarachnoid hemorrhage. An aneurysm had ruptured, blood filling the space around his brain. Emergency surgery clipped the aneurysm, but damage was extensive. 5 weeks in ICU, 3 months in rehab, a year relearning to walk and talk. Stephen recovered enough to teach part-time, which is remarkable. Most don't survive. But he says the first headache was the warning, the leak before the rupture. If he'd gone to the ER that night, he would have avoided months of hell. Know the red flags. Sudden, severe headache reaching maximum intensity within 1 minute. Headache with neck stiffness, confusion, vision changes, or weakness. Headache different from any before, not just worse, but different in character. If you experience these, go to the emergency room immediately, not urgent care. The ER. They'll do a CT scan. These tests can save your life. Here's a weekly self-assessment combining all 5 signs. Do this every Sunday morning. First, look in a mirror and smile big. Are both face sides moving equally? Second, raise both arms straight out. Hold 10 seconds. Does one drift down? Third, say out loud, "The early bird catches the worm." Is your speech clear or slurred? Fourth, stand on one foot 5 seconds. Switch feet. Can you balance equally? Fifth, Think back over the past week. Any confusion, vision changes, dizziness, weakness, or unusual headaches? If yes to any, get evaluated this week. Let's bring this together. 5 critical warning signs: sudden confusion or word finding difficulty, temporary vision loss in one eye, unexplained dizziness, temporary weakness or numbness, and sudden severe headache. Every single one is your brain begging you to take action. Let me share one final story with a happy ending. Linda was 63, a grandmother from Phoenix. She watched one of my videos about stroke warning signs. 2 months later, cooking dinner, her right hand suddenly felt weak. She remembered what I'd said. She remembered Margaret and Robert and Dorothy. She immediately told her husband. He drove her straight to the ER. The stroke workup found a 95% blockage in her left carotid artery and evidence of 2 small recent strokes that hadn't caused permanent damage yet. She was a ticking time bomb. Without intervention, she would almost certainly have a major stroke within weeks. Linda had surgery the next day. They cleared the blockage and placed a stent. She started blood thinners, changed her diet, started walking daily, controlled her blood pressure. That was 11 months ago. Today, Linda is thriving. She plays with grandchildren. She travels. She lives a full, active, joyful life. She tells everyone, "I'm only here because I recognized the warning sign and acted immediately." That's what I want for you. Not survival after devastating stroke, not months of rehabilitation. I want you to catch the warning signs early, get treated, and never have the stroke at all. That's completely possible. Here's your action plan starting tomorrow. Number 1, know your numbers. Get blood pressure, cholesterol, and blood sugar checked. Number 2, take daily aspirin if your doctor recommends it, but talk to them first. Number 3, move your body 30 minutes every day. Walking is perfect. Number 4, eat foods protecting blood vessels. Leafy greens, berries, fatty fish, nuts, olive oil. Number 5, manage stress. Find something calming and do it daily. And number 6, most important, never ignore warning signs. If you experience any of the 5 signs we discussed, get help immediately. Don't wait. Don't downplay it. Your life is precious. Your time with family is precious. Your independence is precious. Protect it. I'm Dr. Valerie Stone, and in my 20 years of practice, I've seen too many people lose everything because they waited too long. I've held hands of stroke patients who can no longer speak, recognize their children, or feed themselves. Almost all had warning signs they ignored. Please don't become another story. Take this seriously. Share this video with everyone you love over 50. The life you save might be your spouse, parent, or best friend. Your brain holds every memory, every skill, every person you've loved. It deserves your protection. It deserves immediate action when it sends a distress signal. In my next video, we'll talk about 5 medications millions of people over 50 take every day that are secretly increasing stroke risk. Some are prescribed, some are over the counter, some are supplements everyone thinks are healthy but are dangerous for blood vessels. Make sure you're here for that. Thank you for trusting me with your health today. I'll see you in the next video. Until then, stay alert, stay healthy, and remember, your brain is always talking to you. All you have to do is listen.